Good morning to everyone. Thanks for joining me this morning to learn more about vector-borne diseases, which is especially important as we're getting into the warmer weather and people are outside more, and you may be exposed to insects that can transmit disease. So that's what we're going to be talking about today. So the first thing we're going to do is I'm going to give a little bit of a background on what vector-borne disease is. And then I'm going to talk about two specific vector-borne diseases that are more common in the United States, and this includes Lyme disease and also West Nile virus. And then at the end, I'll take questions. So there's many different ways that infectious diseases can be transmitted. And one of the ways infectious disease can be transmitted is called vector-borne disease. And these are infections that can be transmitted to humans when a human is bitten by an infected arthropod or insect. And the insect that is transmitting the infectious disease is what we call a vector. So there's many different types of insects. Most of these do not transmit disease, but there are a few that do. And we'll talk about those in just a minute here. So these are very common vectors, mosquitoes, ticks, and fleas. So today we're going to be talking about Lyme disease, which is spread by a specific species of tick. And we're also going to be talking about West Nile virus, which is transmitted by a particular genus of mosquito. Fleas are what transmits plague. I'm not going to talk about that today because fortunately, plague is very rare in the United States. Now, on average, we see about 7 cases of plague across the entire United States. So that's not something that we have to be too concerned about, but we especially need to be concerned about Lyme disease living in New York State. And then I'm also going to talk about the West Nile virus. So what do these insects have in common? Well, they're all blood-sucking insects. And what these insects do is when they take a blood meal from a human, if that human, or if they're taking a blood meal from an animal, that animal is infected with a vector-borne disease, then that insect can suck up that microorganism as it is drawing the blood meal from the human or the animal. And then when the vector goes ahead and takes another blood meal, then that pathogen can be transmitted to the next person or animal that the vector is taking a blood meal from. So that is how the transmission occurs. All right, so we're going to start our conversation about Lyme disease. What I'm going to do is just talk about it in general for a minute, and then I'm going to get into some more specific details about the bacteria that causes Lyme disease and the vector that spreads Lyme disease, and also more about the symptoms and how it's treated. So Lyme disease is important because it is the most common vector-borne disease in the United States. And it is caused by a bacterial agent. So keep in mind there's different types of microorganisms that can cause infectious diseases, and a bacterial agent is one type of microorganism that can cause infectious disease. So this is caused by a bacterial agent, and the name of the bacterial agent is Borrelia burgdorferi. It's not really important that you remember that, but I just wanted to provide you with the actual name of the bacteria. And what can occur is certain species of ticks, specifically black-legged ticks, can be infected with this bacteria, Borrelia burgdorferi, and can transmit Borrelia burgdorferi from a human to a human, or an animal to a human, or a human to an animal, because they can maintain that bacteria in their system. When someone is infected with Borrelia burgdorferi and they actually have Lyme disease, some of the symptoms that they're going to see include fever, headache, fatigue, and also a very characteristic skin rash, which I'm going to talk about in more detail as well. It can be treated pretty easily with a course of antibiotics, but if it's not treated, the infection can spread to the joints. It can also spread to the heart and the nervous system. So there are some complications that can occur if it's not treated. So now we're going to kind of get into more of the details about Lyme disease. So this is an image of the bacteria itself, the Borrelia burgdorferi. You can see that it's kind of spiral in shaped. And it can infect a variety of wild animals and birds, in addition to humans. A common carrier is the white-footed mouse, which is this little mouse pictured here. And some animals are not going to be impacted when they become infected with Borrelia burgdorferi. So that's why this white-footed mouse is called a carrier. So the white-footed mouse can be infected with the bacteria, but it doesn't cause the mouse to become sick or die. And so this white-footed mouse is a very common carrier. Right, so that's the bacteria that causes Lyme disease. Then we also have to think about the tick, which is transmitting the bacteria. So all ticks go through stages to complete a life cycle. And this takes place over a period of 2 years. So they start out as eggs, and then you have larvae hatching from the eggs. And then the larva will progress to the nymph stage. And the nymph stage will then progress to the adult stage. So you have the eggs, you have the larva, you have the nymph, and you have the adult. And for the larva to progress onto the nymph stage, the larva needs to take a blood meal. And from the nymph to move on to the adult stage, that nymph needs to take a blood meal as well. And then adults will take a blood meal before mating. So you can see that there's multiple times in the life cycle where ticks need to take a blood meal in order for this life cycle to progress. Another important thing to recognize is that once a tick is infected with Borrelia burgdorferi, the bacteria that causes Lyme disease, it will remain infected for life. So if it becomes infected as a larva, it will stay infected as a nymph and as an adult. And like the white-footed mouse that we were just talking about, the Borrelia burgdorferi, it doesn't cause the tick any harm. So they can just live normally infected with this bacteria. So this was just general for ticks. All ticks go through this life cycle, but I wanted to talk a little bit about the tick that specifically causes Lyme disease. So these are black-legged ticks. Sometimes you'll hear them referred to as deer ticks as well. And as I said previously, they can be infected with Borrelia burgdorferi, but it doesn't cause the tick any harm. These are actual images here of the tick in the larval stage, the nymph stage, and then the adult stage. And we have both the adult male and we have the adult female. And one thing that's important about these ticks that we have to consider is where they live in terms of geography. So we see these ticks very abundantly in the Northeast, especially in the Northeast, but also we see them in the upper Midwest and some along the Pacific coast as well. And you need to have this specific black-legged tick in order to transmit Lyme disease from an animal to a person or from a person to another person. And so these areas where these ticks are abundant, that's where we're going to see cases of Lyme disease. And this is why we see cases of Lyme disease in New York, because we do have an abundance of black-legged ticks living in our geographic area. So these guys can be really easy to miss because they're small, and especially the larval and the nymph stage are very small. The adult male and the adult female are obviously a little bit bigger and are a little bit easier to visualize. But you can see how, at these the small stages, it would be really easy to miss one of these that is connected to your body. And they especially like to connect to the body in kind of hard to reach or hard to see areas, and which can make it even more difficult. So it is important to recognize how big they are, and that they, especially at the smaller stages, that they can be difficult to visualize. So on this slide, what we're looking at is how Borrelia burgdorferi is maintained in environments. So our nymph stage and our larval stage, they tend to take their blood meal from smaller rodents like the white-footed mouse. And if that white-footed mouse is already infected with Borrelia burgdorferi, then that larva can pick up the bacteria, and it will continue to be infected as it moves through its other life stages. The infected adults, they tend to bite larger mammals, so they'll bite humans. They may also bite deers as well. And so if you have a, a larva that was infected when they took a blood meal from a white-footed mouse, and then they became infected with Borrelia burgdorferi, and then as an adult they take a blood meal from a human, then they can transmit Borrelia burgdorferi to that human. And so this is how ticks and wild animals maintain Borrelia burgdorferi in our environment. So there's some misconception about ticks. Some people think that they can fly, some people think they may be able to jump, but they can't do either of those things. So they don't fly and they don't jump. What they do is they do this behavior called questing, which is what you see in the image here. So you'll have a tick that crawls to the end of tall grasses or in a wooded area. It's going to be on foliage that it can hold on to, and then it kind of spreads out its appendages here. And what it's waiting for is it's waiting for a host to brush past. Because it can't fly or hop, it needs the host to come in contact with it, and then it uses these appendages to grab onto that host, and it really can attach itself to any part of the human body. And they do like to find harder to see areas. On the slide, you can see a couple of examples. So in this image here, we have an individual that has a tick that's attached to the scalp. So if someone has a thick head of hair, that can be really difficult to recognize. And here's an individual here that has a tick that's attached right to the individual's eyelid. So some very kind of interesting and hard to see areas. So what the tick does is it attaches itself to the host, and it will suck blood slowly over a period of several days. And oftentimes it might not be noticed by the individual because it's not really painful. It's happening very slowly over time. And then once they have completed taking their blood meal over that period of days, then they drop off and they will prepare for the next stage of their life cycle. So this image here is an image of a tick that I found on my son. So it was easy to see this tick because it was right on his belly. So, when I was helping him get undressed, it was easy for me to pick that out. And so I was lucky. I was able to remove that tick very quickly. And I knew when he had been exposed to it because he had been running around in some outdoor wooded area a couple hours before. So I knew that the tick had not been on long. But if it had been, say behind his ear or maybe in his scalp, it would have been much more difficult for me to recognize it. All right, so if someone is bitten by a tick, this does not mean that they are going to definitely get Lyme disease. So first of all, they could be bitten by a tick that's not a black-legged tick. It might be a different species of tick. Or they could be bitten by a black-legged tick that's not infected with Borrelia burgdorferi. So if the tick is not infected, then it's not going to transmit the bacteria to a person. But if they are bitten by a black-legged tick that is infected with Borrelia burgdorferi, and the tick remains attached for long enough, at least 24 hours, then transmission can occur to the individual. And if an individual is going to experience Lyme disease, there's going to be an incubation period. This is the time between when they're exposed to the tick and then when they develop symptoms. And this is a broad range, so it can be anywhere from 3 days to 30 days, but on average, it's about a week after the tick bite occurs. But it can be up to a month, and that makes it a little more complicated because you may not remember what happened a month ago. So sometimes it can be hard to kind of pinpoint when the bite actually occurred. But on average, the symptoms are going to occur about 7 days after the bite occurs. And about 70 to 80% of individuals are going to experience a rash called erythema migrans. And on the next slide, I'm going to show you some pictures of this. And this is a very characteristic rash that is associated with Lyme disease. But of course, there are some folks, 20 to 30%, that aren't going to experience that erythema migrans, but most will. And then there's other symptoms that are associated with Lyme disease as well, including fever and headache, muscle and joint pain, and also fatigue. So let's take a look at this erythema migrans rash. So this first image here is what the classic erythema migrans rash is always pictured at. So this is the picture that you're going to see in the textbook. It looks like a target lesion. And it develops at the site of the tick bite, and it starts small, but then it expands over time, and it can actually expand up to about 12 inches in diameter. And what happens is as it expands, sometimes it begins to clear, and that's how you get this target-like appearance. So if you have a rash that looks like this is very, very likely erythema migrans. So nothing else looks like this. But the erythema migrans can look different. And so I have some other pictures on here that show you erythema migrans on other individuals. So you can see that it's not always a target lesion. On this individual here, really the lesion is completely full without that target area. And then I also wanted to point out that it can be more difficult to recognize on someone that has darker skin. So we have an erythema migrans rash here, but this can be more difficult to identify. So it can look a number of different ways, and it's going to manifest itself differently on different individuals and may look different with different skin tones. So if someone is identified as being infected with Lyme disease, then there is treatment. So they can be treated with 2 to 4 weeks of antibiotics. And if the individual is caught relatively early and they get their treatment quickly, they're typically going to recover completely. but there are some complications that can occur if someone is not treated. So if someone is not treated for Lyme disease, it can lead to complications such as chronic joint pain. So they can experience arthritis, which causes pain and inflammation in the joints. Some individuals can experience neuropathy or nerve impairments. We especially see a facial palsy where you have an impairment of one of the facial nerves. So you can see in this image here, this individual, one side of her face is drooping, and that is because the facial nerve has been impaired as a result of her Lyme disease infection. Some individuals can have a cognitive impairment. This might be, difficulty with memory or concentration. And some individuals can even have cardiac problems. Most commonly, it is the inflammation of the heart muscle. So there are more severe consequences that can occur if Lyme disease is not treated. And then there's also something called post-treatment Lyme disease syndrome. And this occurs when someone has been adequately treated, but they continue to have symptoms 6 or more months following their treatment. And retreating these individuals is not helpful, unfortunately. Now, only about 10 to 20% of those infected are going to go on to have post-treatment Lyme disease syndrome. So, thankfully it's a smaller amount of individuals, but for these individuals, it can be difficult because they continue with pain, they continue with fatigue, they can even continue with cognitive impairments months after their infection. And at this point, why this happens is not fully understood. So really the cause is unknown. And unfortunately, we don't have anything to treat it. So if you, like I said previously, if you give the individual more antibiotics, that's not going to make their post-treatment Lyme disease syndrome go away. So really all we can do in this situation is manage symptoms. So the best way to prevent this is to get Lyme disease in the first place. And in a few minutes, I'll talk about how you can prevent Lyme disease. All right, so now that we've talked about the bacteria that causes Lyme disease and the vector that spreads it, we've also talked about the disease itself. I'm going to talk a little bit about the epidemiology of Lyme disease. So looking at number of cases and looking at number of cases over time and how they're distributed among populations. So the Centers for Disease Control and Prevention, they collect data on individuals that become infected with Lyme disease. This is a reportable event. So if it is recognized that if a medical provider recognizes that someone is infected with Lyme disease, then this will get reported to local health departments, who will report it up to the state, and then the CDC will collect information across the states and put all this data together so that we can get a picture of what's going on across the country. So on the CDC's website, they have data going back to 1996. And what we're looking at here is we're looking at reported cases by year from 1996 through 2020. So they don't have the most recent data available on their website yet. Usually it takes a couple years for all the data to be gathered and processed. So this is the most current data available. So along our x-axis here, we have year, and then along our y-axis here, we have number of cases. And there's a couple of points I want to make. So one thing to point out here is that there's two different colors. So we have this kind of more of a teal color green. These are confirmed cases. And then in 2008, they also started capturing probable cases. And so that's why you see this added olive bar on top. Those are our probable cases. But one big take-home point here is that over past decades, we see an increasing trend. So we see an increase in the number of Lyme disease cases that are being reported in the United States. Now, one caveat here is the year 2020. However, this data here is not public health doing an amazing job and preventing half the cases of Lyme disease. And so suddenly we're doing really well in terms of preventing Lyme disease cases. The reason why the data looks different for 2020 is because of the pandemic. So anytime you're looking at data, disease data, you always have to keep in mind that if that data includes 2020 data or even 2021 data, but mostly the 2020 data is often it may be skewed because of what was happening during that time with the pandemic. So, for example, someone might not have presented to their primary care provider because individuals were trying to stay home and quarantine and stay away from medical treatment facilities unless they really had to be seen. And so there's many cases that just went unreported. So as we continue following this data, I think we're going to see it, continue to trend up. I think that's just the 2020 data is purely a result of the pandemic. And then this is looking at a map of the United States. We can get an idea about where these cases are occurring in terms of geography. And like I said previously, it comes down to where the black-legged tick resides geographically. So we see those black-legged ticks in the Northeast and the upper Midwest. We see some on the Pacific coast as well. And that is where you're going to have cases occurring, because you have to have that vector present in order for cases to become, or for someone to become infected. And so you can see that New York is one of the areas where we have a lot of Lyme disease cases occurring. Each one of those little green dots represents a case that has been identified in a particular county. So that's why it's important to be familiar with Lyme disease, because we certainly have a lot of cases that are occurring in New York State. Now, this is a really busy slide, but I wanted to show it because what it's showing is it's showing the top 10 states in terms of number of cases of Lyme disease in the US by year. So we have year 2008 through 2020. And then we have on our y-axis, we have number of cases. And New York is in this kind of darker green. So I'm just going to trace it here for you. You can see that New York is one of the top states. So this is top 10, but really New York is really among the top 3 when it comes to cases of Lyme disease, along with Pennsylvania and New Jersey as well. So, that core area is where many of the cases are occurring. Another thing to recognize about the epidemiology of Lyme disease is we want to know what types of individuals in terms of their demographics are more likely to become infected with Lyme disease. And so one of the demographics we like to look at is age. And so that's what we're looking at here. So we're looking at among all cases that occurred from 2008 to 2020, how were they distributed by age? And so we have our age ranges down at the bottom, 0 to 4, 5 to 9, 10 to 14, etc., all the way up to 85 plus. And then on our y-axis, we have percentage. And so you can see that we have 2 peaks that occur. So we have a peak that occurs in the 5 to 9 age group, and then we have another peak that occurs in the 55 to 59 age group. And then I'm sorry I didn't mention, but this is also divided by male and female. So the green is male and the red is female. But in both males and females, we see a peak in the 5 to 9 age range, and we see a peak in the 50 to 59-year-old age range. And this very likely is due to behavior, and that individuals in these age ranges are outdoors and being exposed to the vector. If you're exposed to the vector more, then you're going to increase the risk of disease. So the best way to prevent yourself from becoming infected with Lyme disease is to prevent the tick bites from happening in the first place, or removing the tick early enough that it doesn't have enough time for transmission to occur. So if you're in an area, a woodsy area, one thing you can do is you can protect your skin by wearing long sleeves, long pants, even tucking the pants into your boots. Say you're hiking, you could tuck the pants into your hiking boots. You could wear a hat to try to cover your ears. Another thing you can do is you can use insect repellent. So you want to, cover yourself with insect repellent before you go out into a wooded area. And remember that the ticks cannot fly or hop, and they really need to brush up against a host in order to grab onto that host so it can attach and start taking a blood meal. So if you're say you're hiking a trail, if you stay in the center, the middle of that trail, and you're not brushing up against the foliage along the side, this can help prevent tick bites because you're not coming in contact with that tick, and the tick can't grab onto because you're not brushing up against that foliage. So those are things you can do to prevent the tick from attaching in the first place. But then there's also things you can do to help make sure that you are identifying and removing any tick that you do find. So after you've spent time outdoors, it's always good to do a tick check. And you especially want to check in hard to reach areas because they like to go in hard to reach areas like the scalp, in armpits, in the groin, in the ears. So you want to check for ticks, and then you want to remove them as quickly as possible, because that tick does have to be attached for at least 24 hours for transmission to occur. So if you do identify a tick, you want to remove it immediately. And you can do this yourself with a pair of clean, narrow tweezers. And as you see in the image here, you want to grab the tick as close to the skin as possible with those tweezers. And you want to pull directly upward at a 90-degree angle from the skin, and pull out the tick and pull out the mouth parts as you're pulling out the tick. And then of course you want to get rid of the tick. You can do that easily by flushing it down the toilet. And then you're going to want to wash the area where the tick was attached. So this image here is really just to be funny. I can't imagine trying to check Chewbacca for ticks. And this is just a reminder that you really want to make sure you're checking those hard to reach areas after you come in from spending time outdoors, especially if you were hiking through a woody area with tall grasses. Okay, so that's all I have on Lyme disease. Now I'm going to transition to discuss West Nile virus. All right, so West Nile virus is the leading cause of mosquito-borne disease in the continental US. So when we talk about vector-borne disease in general, Lyme disease is the #1 vector-borne disease. But when we're specifically thinking about diseases that are transmitted by mosquitoes, West Nile virus is the most common mosquito-borne disease in the United States. And it's going to cause a febrile illness in 1 out of 5 individuals that are infected. So, and in those other individuals, they don't experience symptoms. So many individuals end up that are infected end up being asymptomatic or not displaying any symptoms. But this is an important disease because it can also cause a very severe and sometimes fatal illness in about 1 of every 150 individuals that are infected. And unfortunately, there is no treatment available. So West Nile virus is caused by the virus. So West Nile viruses are named a little bit differently than bacteria. So bacteria are named by their genus and species, like we saw with Borrelia burgdorferi causing Lyme disease, but West Nile virus disease is caused by West Nile virus. So it is a viral agent, and you cannot use antibiotics to treat West Nile virus. So we can only offer individuals supportive care. So if an individual is one of those that does experience symptoms, the more milder febrile illness, they will have fever, they can have swollen lymph nodes, they can have muscle pains, they can have joint pain, they can have nausea and vomiting. But if someone progresses on to the much more serious form of the disease, which is called neuroinvasive West Nile, then they can become much sicker. And what can happen is the virus can infect the brain, causing brain swelling, and the medical term for that is encephalitis. It can also infect the coverings of the brain called the meninges, and when that occurs, the medical term for that is meningitis. So it can cause this inflammation, and then as a result, the individual has severe symptoms like very high fever, severe headache, neck stiffness, neurologic symptoms like disorientation, confusion. They can even fall into a coma and have convulsions and even paralysis. So this neuroinvasive form of West Nile is very serious, and this is the main reason why we track this and try to better understand West Nile virus so we can prevent these neuroinvasive cases from occurring. And as I mentioned previously, there is no treatment for this. So treatment is just going to be supportive, and 1 of 10 that become infected with neuroinvasive West Nile virus will die as a result of their illness. So what this is showing is it's giving you an idea about what proportion of individuals are going to experience the different types of diseases that can result of becoming infected West Nile virus. So if this pie here is everyone infected with West Nile virus, the orange piece of the pie are those that aren't going to experience symptoms at all. So they'll be infected, but they don't even know they're infected because they're not experiencing any symptoms. So this is close to 80%, about 79% of people. And then the individuals in this blue piece of the pie, these are those that are going to have symptoms, and they're going to have a febrile illness with fever, headache, and body aches, kind of a flu-like illness without the respiratory symptoms, but you get the fever and the body aches and headaches. And then this very small slice of the pie here in yellow, less than 1%, are those individuals that go on to develop West Nile encephalitis or West Nile meningitis with very severe headache, high fever, and neurologic impairment as well. So kind of the take-home point here is that the majority of individuals aren't going to experience symptoms. And many that do experience symptoms, the symptoms are going to be more mild, but we do have this about 1 in 150 that are going to experience very severe symptoms. Right, so when we were talking about Lyme disease, we talked about how the black-legged tick is the vector that transmits Lyme disease. Here for West Nile virus, our vector is a genus of mosquito called Culex. So Culex mosquitoes are going to be the mosquito that transmits West Nile virus. And it is only going to be transmitted by female mosquitoes because only female mosquitoes take a blood meal. They need to take a blood meal in order for their eggs to develop and for them to lay eggs. And culex, they will feed on birds and mammals. And they're active dawn till dusk, but they're most active at dawn and dusk. So we previously talked about how Borrelia burgdorferi is maintained in environments. So here we're looking at the same thing for West Nile virus. So birds can become infected with West Nile virus. In fact, West Nile virus has been isolated from at least 138 species of birds in the United States. And in many cases, this will cause illness and mortality in the birds. Sometimes this can be used as kind of a trigger warning. If we see more dead birds than we're expecting to see, it may be that there's going to be an outbreak of West Nile virus occurring among humans. So in the environment, West Nile virus is maintained in the Culex mosquitoes and in various species of birds. But these Culex mosquitoes will also bite mammals, specifically humans and horses as well. And if a Culex mosquito is infected with West Nile virus and then takes a blood meal from a human or a horse, it can transmit that West Nile virus to those hosts. But I will say that both humans and horses are considered what we call dead end hosts. So it won't continue to be transmitted from either a human or a horse. But in birds, if a bird is infected with West Nile virus and a mosquito takes a blood meal from that bird, on a subsequent blood meal, it can then transmit to another bird, or it can transmit to a human, or it can transmit to a horse. So that's how West Nile virus remains established in our environment. So West Nile virus is much less common than Lyme disease, and it occurs sporadically. What we're looking at here is we're looking at data that was again collected by the Center for Disease Control and Prevention. They started the West Nile virus is a relatively new virus. It was first identified in the United States, in New York, actually, in 1999. But we have had cases that have occurred every year since then. So we're looking at data from 1999 through 2021 on our x-axis, and then on our y-axis we have incidence in the population. So incidence is a fancy way of saying new cases within a population. So this is how we measure a number of new cases that are occurring. And so you can't see that there's any, real pattern here. I think what might be interesting is if we start to see a wave pattern, because it does seem like it's starting to go into a wave pattern, but I think that's not going to be clear until we move forward into the future and are collecting more data. But when we look at all cases that have occurred from 1999, we have about 28,000 neuroinvasive cases that have been reported. So the CDC only collects information on the neuroinvasive cases. It does not collect information on those that have West Nile and have mild symptoms. And for those that don't have symptoms at all, they're not going to be tested, so we wouldn't know about those cases anyways. So I think it's important to recognize that the neuroinvasive cases are very rare. So we've had 28,000, since we first recognized West Nile virus in the United States in 1999. But it's also important to recognize that there's been many additional cases that haven't been reported, because there's going to be all those individuals that are having symptoms, milder symptoms, and all those individuals that are asymptomatic altogether. But importantly, they collect the numbers of neuroinvasive cases. This is a map of the United States. You can see which geographic area has the highest incidence of cases. And so this is looking at the average incidence, or a number of new cases by state from 1999 to 2021. And as the color green gets darker, that indicates a higher incidence. So you can see that New York is in a very light color. And so this means that in New York, we have a low incidence of West Nile neuroinvasive cases occurring. So compared to some other parts of the country, we have fewer cases. But it is important to recognize that older age puts someone at increased risk for developing neuroinvasive disease. And so what we're looking at here is we're looking at average annual incidence by age group. And so on our x-axis, we have age ranges, so less than 10, 10 to 19, 20 to 29, all the way up to 70 and older. And then on the y-axis, we have our incidence. And you can see that as individuals age, they become much more susceptible to developing neuroinvasive disease, so that, most of the individuals that are developing neuroinvasive disease are older adults. So like Lyme disease, in the way that the best way to prevent it from occurring is to prevent tick bites from occurring, we have that same mantra for West Nile virus as well. We really want to just prevent the mosquito bites from occurring in the first place. So you can use a couple of the same methods we use to prevent Lyme disease, including dressing to protect yourself. So long pants, long sleeves, tucking pants into boots, wearing a hat. Also utilizing bug repellent that contains DEET, so that you can make sure that you're trying to keep those mosquitoes away if you're, especially if you're outdoors at night. You want to try to avoid that peak activity, which is dawn and dusk. But sometimes that can be hard. That's when individuals are outside during that time. So if you're going to be outside during that peak activity, you really want to make sure that you have your skin covered and you're wearing bug repellent. And then there's also some things that you can do to help decrease the number of vectors kind of in and around your home. So all mosquitoes breed in standing water. So if you have any type of object that can collect water around your home, and that water remains there, you can have mosquitoes that breed in that water. So you want to try to dump objects like tires or toys or buckets that are filled with rainwater to prevent that breeding from occurring. And then you also want to make sure that your home is protected. So if you have windows, make sure that you have screens on your windows, and or mesh on your windows, or open doors, so that you can prevent the insects from coming inside your home. Right, and that is all I have on West Nile virus. So at this point, I'm happy to take any questions that individuals have.
There are a few questions in the chat. So let me just go back and get those. Okay, the first question here is from Lori. And she says, can you get Lyme disease from an infected pet who walks outside with you?
No. So dogs can get Lyme. So say you have a dog, dogs can actually get Lyme disease. They can become infected by an infected tick. But if your dog is infected, your dog is not going to be able to transmit it to you. The only way a person is going to be infected is if they are bitten by an infected tick, black-legged tick.
Okay. Next question. Is DEET bad for a person or the environment, like for your skin?
So that's a kind of a risk and benefit situation that you have to consider. So, you know, there can be some harmful effects if you're, if you're overusing, insect repellents, but you have to take kind of that small risk into account when you're thinking about the risk of, diseases that can be transmitted by insects. So, for me, I see the risk of or the benefit of the DEET outweighing the risk, so that when I and my family go outside in the evening or walking through like a wooded area, I always use insect repellent. So there's, these products, these products are not 100% safe. But I think that again, it's kind of like a risk benefit analysis that you have to do. Now, there are products that you can get that do not contain DEET, but they just don't work as well. So the DEET is gonna work the best.
Okay. And then a couple of questions here from Gwen. Okay, how much of a risky territory for infected ticks is the average suburban mowed grass backyard area?
Well, if you have in your backyard, if you have um, tall grasses and shrubby areas, you can have ticks present. It's going to be less of a risk than, say, you go out into you're in Allegheny and you're walking through trails in Allegheny, but ticks can be present in smaller areas. So keep in mind that some of the mammals that carry Borrelia burgdorferi are very small, like the white-footed mouse. So as long as you can have small mammals in an area, then you can sustain that life cycle for Borrelia burgdorferi between mammals and ticks that could then potentially transmit to humans. So when my son was bitten, he was just we were at an outdoor church ceremony in the suburbs, and there was just a little bit of a woodsy area behind the parking lot. That's where he was running around, and that's where he was bitten by the tick.
Okay. Then a second part to the question, how is Lyme diagnosed specifically, and can it be diagnosed years after being infected? Is it something that can affect your health for a long period of time if you had been bitten and infected and it went undiagnosed?
Yeah, so how it's going to get diagnosed is through a blood test. Now, some if Lyme disease is really common in an area, sometimes you might have a provider that, if you have the erythema migrans and you have other symptoms and you have evidence of a tick bite, then you would be considered, you know, a probable case, like you most likely have Lyme disease. But for confirmatory testing, you would need to do a blood test in order to get tested. And it can sometimes Lyme disease will resolve on its own. And that's one of the reasons why we actually think there's many, many more Lyme disease cases happening than are actually reported. So even 8 to 10 times higher than what is being reported to the CDC, because Lyme can resolve on its own, but it can also not resolve on its own. And if it's not treated, and it doesn't resolve on its own, then the individual can go on to have issues like arthritis, like heart conditions, specifically myocarditis, where the muscle of the heart is being inflamed. So that can be a problem. And then in terms of, you should be able to have it diagnosed later on in life, just because the antibodies are still present.
Okay. So the antibodies would be present for a long time?
Right.
Wow, okay.
There's
All
about
right, and then from
different
Jim.
types of, I'm sorry, there's different types of antibodies. There's some antibodies that are going to be more temporary antibodies, but then there's also longer lasting antibodies.
Okay. All right, Jim has a question. Has climate change altered the tick and mosquito life cycle?
So, it hasn't, it's affected the life cycle in the sense that we're having areas that didn't used to, so I think probably the best way to think about it is we can think about it specifically for the ticks. So ticks are only active, you know, during a certain type of climate. And that's during kind of late spring through the summer. And what's happening is that season in some areas is becoming longer. So we have longer periods of time where ticks can be active. And so you need that vector in order for that transmission to occur. And so when you have longer periods of time that ticks are active, then you have more opportunity for ticks to come in contact with humans and then for transmission to occur. And then kind of the same thing is true of mosquitoes, that you know, mosquitoes prefer a specific type of climate. And if you're expanding that amount of time when that specific climate is occurring, then you're expanding the amount of time that mosquitoes can breed and mosquitoes can come in contact with hosts. And so, yes, climate change is playing a role because it's changing the seasonality of when these vectors are active, and so they can be active for longer periods of time.
Okay. And then I think there's just a comment. Any blood tests to detect? So I believe we went over that. There are blood tests.
Yes, there is for both Lyme and West Nile virus, but there's specific tests, but for both Lyme and West Nile virus, there's tests that can be done.
And then the next, we have a lot of deer around our home. Are they carriers?
So deer, the reason why deer can be a problem is specifically for Lyme disease is that ticks like to mate on deer. And they also can, you know, transmit to the deer, but the deer, kind of like when we were talking about with West Nile virus and how humans and horses are a dead end host, that same is true for deer. But when you have a lot of deer, you can have more mating occurring because ticks like to mate on deer. And then if you have more mating occurring, then you're just having more ticks being born, or the eggs being laid, then the nymphs coming from the eggs. So deer can increase your population of ticks because they offer a breeding ground for mating.
Okay. Are chipmunks considered a risky rodent?
So chipmunks, so I don't know specifically, but I'm pretty certain that that chipmunks can become carriers. So that they could, kind of like the white-footed mouse, where they can become infected with Borrelia burgdorferi, and then they could later on be bitten by a tick that then bites a human.
And the last question here, is there a vaccine for Lyme disease?
So a while ago, there was a vaccine that was made available in the United States, and in 2002, it became no longer available because there wasn't demand for it. But right now, there are ongoing clinical trials, phase 3 trials that are being done for a new Lyme disease vaccine. But there's not a vaccine available right now. But hopefully these trials will be successful, and then we may have a vaccine in the future. There's also some testing being done in terms of monoclonal antibodies for Lyme disease, which would be taken as a prophylactic. So the thought is that you would take it before the summer season or the tick season starts, and then it would prevent you from becoming infected with Lyme disease during that period. There is no vaccine for West Nile virus.
Okay. All right. Thank you so much. Great and thorough presentation.
Good. I'm glad. I hope everyone got something out of it and learned something. And just make sure you protect yourself when you're going out, and make sure you're doing those tick checks.
And again, this is recorded and will be available in a day or two on our University Express website if you want to direct friends or family to that. And does anyone have a question they want to ask verbally? If you called in, I could unmute you and you could ask a question. All you have to do is raise your hand and I can open that up for you to ask a question. Okay, looks like we're good then. Thank you so much, Dr. Zorich.
You're very welcome.
For all of the information, and we look forward to having you back in the fall. So check our class catalog, and we will have Dr. Zorich back with us in the fall, possibly in person. We were kind of talking about that, but we will let you know. Okay, everyone, enjoy today's weather. My favorite kind of day, nice and cool, to go out and have some fun. Take care. Thank you.
Bye, everyone.